better get used to me, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving. I think I'm starting to realize not everything has to be alright. Just keep your head up and hold on tight. Shake off the dirt and throw it right down the line. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, I got a really good feeling, I got a really good feeling. Got a really good feeling, I got a really good feeling. Oh, it's a good day to be alive. I count my blessings and keep them all at my side. There ain't no stopping us, we're starting to ride. We keep on running and we're feeling alright. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop moving, I can't stop moving, oh. Got a really good feeling, I got a really good feeling, oh. Can't stop I think I'm starting to realize not everything has to be alright. Just keep your head up and hold on tight. Shake off the dirt and throw it right down the line. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Can't stop moving now, can't stop moving. has to be alright. Just keep your head up and hold on tight. Shake off the dirt and throw it right down the line. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Can't stop moving now, can't stop moving. Got a really good feeling now, got a really good feeling. Can't stop moving now, can't stop moving. Can't stop moving now, can't stop moving. Got a really good feeling now, got a really good feeling. Can't stop moving now, can't stop moving now. Got a really good feeling now, got a really good feeling. Got a really good feeling now, got a really good feeling. Oh, it's a good day to be alive. I count my blessings and keep them all at my side. There ain't no stopping us, we're starting to ride. We keep on running and we're feeling alright. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Can't stop moving now, can't stop moving. Got a really good feeling now, got a really good feeling. Can't stop moving now, can't stop moving. I think I'm starting to realize not everything has to be alright. Just keep your head up and hold on tight. Shake off the dirt and throw it right down the line. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Can't stop moving now, can't stop moving. Got a really good feeling now, got a really good feeling. Can't stop moving now, can't stop moving. Can't stop moving now, can't stop moving. Got a really good feeling now, got a really good feeling. Can't stop moving now, can't stop moving now. Got a really good feeling now, got a really good feeling. Got a really good feeling now, got a really good feeling. Oh, it's a good day to be alive. I count my blessings and keep them all at my side. There ain't no stopping us, we're starting to ride. We keep on running and we're feeling alright. Go on, get loose. Yeah, you better get used to me, go get loose. Yeah, you better get used to me, yo. Can't stop moving now, can't stop moving. Got a really good feeling now, got a really good feeling. Can't stop moving now, can't stop moving. I think I'm starting to realize not everything has to be alright. Just keep.
Towards the middle of March 2020, the world began to look and feel a lot different for all of us. Scary and confusing sights and sounds were all around us. Then, the stay-at-home and shelter-in-place orders effectively established a lockdown as we began to see people we cared about around us get sick and in all too many cases die. The reports of Black and Latinx communities disproportionately impacted by COVID-related deaths and infections invaded our consciousness. Mutual aid efforts sprang up in response to these reports, and the reality hit home that millions of people who call America home were out of work, unable to pay their rent and mortgage, incapable of putting food on their tables, or ensuring their children receive a quality education. As we were attempting to adjust to the disruption the global pandemic brought to our lives, we sat transfixed to our screens watching George Floyd callously murdered in broad daylight. And the world changed again. Collectively, we awakened to the reality of simultaneous pandemics. Not only was our ability to stay healthy under attack, our capacity for economic security had been compromised. And we also had a front row seat to the pervasive nature of structural racism. The reckoning was upon us. Change wasn't just a coming, it was now here. Community organizing groups across the country were engaging their base to not just meet the needs of their communities, but to create new paradigms by which local and national institutions had to respond. Government, philanthropy, civic groups, corporations, etc., everyone was being ushered into a new world by organizers. The world was introduced to terms like BIPOC and racial equity, and then came the backlash. I'm sure most of us can remember where we were when we received the news that the U.S. Capitol had been breached and blood spilled in the people's house, which wasn't just about the results of an election, but more importantly, about a belief that a way of life was being stolen from those who considered themselves the true patriots. Months removed from these events, we at the Wieboldt Foundation invite you to reflect on what we've seen, heard, and experienced over the last 18 months to bring those lessons forward to shape the future our grandchildren will be born into. Doing what we've been doing for the past 5 decades and coinciding with the Wieboldt Foundation's 100th anniversary, we're here to interrogate how the critical systems we rely upon can better serve our communities. We invite you to join us as we hold conversations to inspire us to change the way forward, centering the experiences of the people most impacted by these issues and framed from the expertise of the organizers who work to address these issues daily. Thank you for being here. And as you watch our panel discussion tonight, please ask yourself what you can do in this moment to get us all a little closer to where we need to be as a nation. Enjoy. And so, my name is Juwan Malone. I'm the Executive Director for the Wieboldt Foundation. I want to thank Forefront, the Neighborhood Funders Group, and Northern Trust for their generous support that helped to make tonight possible, and for all the other activities we're having throughout the rest of the fall to commemorate our 100th anniversary. We've assembled an amazing panel for you tonight to provide us with the big solutions we need to be considering as we work towards a new future that learns from the mistakes of our past. Now, there's a few questions that I'm going to ask our distinguished panel here, but you will have an opportunity to ask questions before you leave here tonight. So I want to jump right into the conversation. Now, the questions are going to be answered succinctly by our panelists. The first question, they have 3 minutes to respond to. So I'm going to ask them to introduce themselves. And as they introduce themselves, they're going to tell us what they envision when they think about ensuring access to quality health care. And so we're going to start with Ms. Joyce Ball.
Thank you, Juwan Malone, for inviting me, and I'm very grateful to be able to celebrate this 100-year anniversary. When just speaking about what's going on now, my name is Joyce. I'm a nurse. I've been a nurse for over 30 years. I worked in the emergency department for over 29 years, so I have experience in that area. And I'm also working with the National Nurses United as far as the collective bargaining team, being able to fight for the patients, fight for the nurses, to fight for fairness and safety of everyone involved in that person's care. Also, I'm also actively training for a SANE nurse, which is sexual assault nurse examiner. Since the pandemic, sexual assault has been on the rise. Many people aren't reporting it, and it needs to be reported. So my vision is that healthcare should be affordable for everyone, regardless of your status in life. It should not be a limit on how much care we can do for a person, and that is my vision for healthcare at this moment.
Dr. Rogers?
Hi, everyone. Thank you so much for inviting me to be part of this panel. I'm Dr. Susan Rogers, and I am president of Physicians for a National Health Program, which is an organization of over 23,000 physicians and ancillary health staff and other health workers who are working so that this country can get single-payer health care, Medicare for all. I grew up in Chicago, a product of the public school system here, and I think I first became aware of social activism when I was about 11 or 12, and my mother took my brother and sister and me downtown to march with Dr. King, who had come here to march against segregation in the city. And during this time, this was when Ben Willis, who was the superintendent of schools, didn't want to build schools in neighborhoods where black children were. He wanted to just put the mobile van things in the parking lots for us to access care. They called them Willis wagons at the time. And so we marched against them. And that kind of opened my eyes to social activism, doing the right thing. It's not all about me. And so that sort of stayed with me. And after I did end up going to medical school here in Chicago at the University of Illinois. And when I went to medical school, I said, I'm going to train at Cook County. I'm going to train because I'm going to be a doctor to take care of black people. And that was my mission. Never set foot in Cook County before that. And I've been there many, many years since. I did leave for a while, but that's been my goal. That's why I do what I do. And I became involved with Physicians for a National Health Program because I saw the inequities firsthand. I saw what was wrong. I saw people go without, and I saw the devastation that created with the people that I took care of then. So right now, this is my mission now, for us to get Medicare for all, single payer, so that we all can have access to health care, that we can get some equity in this country on one thing at least, which would be health care. And that's what I do. I retired from Cook County. I continued as a volunteer physician for a while, and then I wanted to come back, but they said I was too old and high risk because of COVID. So, but I am still very, very still much involved.
Thank you.
Well, good evening, everyone. My name is Linda Murray. I'm also a retired Cook County physician. I was born and raised in Cleveland, Ohio. And in January, when our nation's capital was overrun, and Senator Ted Cruz stood up on the floor of the Senate and said this reminded them of the election of 1877. I remembered enough of my high school history to remember that that's the election that Rutherford B. Hayes won, supposedly. There was an agreement that he would become president if he took the troops, the Union troops, out of the South, out of the old Confederacy. And that's what launched in an official way the terrorism from the Klan and others that we're still living under today. So my goal as a physician, I'm not interested in simply having people be able to afford access to medical care. That's basic. I think health care is a basic human right, and I believe in order to be healthy and to have well-being, that you have to have a democracy. You have to have a country where social justice is the main reality. And what I want to ask as we have this conversation is, can we half-step? What can we half-step? We half-stepped on emancipation, on ending slavery. We half-stepped on that. We didn't get 40 acres and a mule, and we didn't get the vote. Think of all the things we didn't get. So here we are today in the things that Brother Malone listed. So what are we willing to half-step on so that our grandchildren don't get what they deserve?
Come on.
So I feel like, I just turned 73. I feel like now's the time when we need to demand everything we deserve.
Come on now.
And we need to fight for what we need.
Yes.
All right. Thank you.
Hi, everybody. My name is Sam Wickham. I am a leader and board member at One North Side here in Chicago. We are a community organizing nonprofit on the north side, and we organize folks from Lakeview or Lincoln Park to Rogers Park around economic justice, mental health justice, housing, affordable housing, violence prevention. And I am on the mental health justice team and economic justice teams, besides being a board member. And I mean, I've got a long introductory story written out, but Juwanza made sure that I knew that we only had 3 minutes to answer both parts of the question. So I'm just going to pretend that I didn't write that all night last night trying to get it perfect. And I'm just going to say I live with severe, unremitting depression. The first time I tried to kill myself, I was 10 years old. I lived that way until I was 44 and finally got to the point where I could not function. I was a non-functioning human being, just vegetable living in a bed. And finally ended up homeless, a bunch of stuff, got help, got medication, get services at a community mental health center on the north side. It saved my life, being in John J. Madden Hospital down in Maywood. That place saved my life. It was scary, it was not pretty, but they saved me. And so the place where the community health center that I get services at is called C4, Community Mental Health Centers of Chicago, and Community Counseling Centers of Chicago. And I found One North Side through C4. It was totally by accident. And finally, I've got my life's purpose. I spent all those years trying to kill myself, and I would wake up, and God just kept going, no, you're going to stay. No, you're going to stay. And I kept going, why? I would wake up so angry, and I tried so many different ways, and I just wanted to be done, and God just wouldn't let me go. And I finally know why now today. And that's a blessing. I just turned 58. And it's a blessing to know that. And I get to every day work with the people in the communities and find out what they need, what they think the solutions are. And then folks like Juwanza and Wieboldt fund our missions. And it's an amazing thing, and that's the only reason why we get to do the work we do, is that we have fabulous funders who believe in our work. And right now, I'm working on a couple of federal level, our team is working on a couple of federal level campaigns, and we're working on Medicare for All, which is not, to me, the solution, but it's the closest thing that we have right now. There's no way we're going to be able to jump directly to healthcare for all, what folks may have heard called socialized medicine. It works. It works all over the world. We're the only industrial country who doesn't do it. You know why? Because we're a little cuckoo. And I can say that because I'm a little cuckoo. We don't want to do things. We don't want to do things other people are doing. We don't want to be told what to do. We have people making billions and billions and billions of dollars while people are dying. Almost 700,000 people have died. And we got, what, a handful of guys making billions and billions and billions of dollars off of us. That's wrong. They have all the money, they have all the resources. We need that money, we need those resources to help our people, to make sure that our people have health care, to make sure that our people have college and pre-K and all kinds of stuff. But we allow those people to make all that money and steal our futures from us. We gotta stop doing that. We gotta take control, we gotta get in the street, we gotta organize. We gotta stop them. Because if we don't stop them, look at what they're doing in Texas. And if we allow that to stand, they're not gonna stop there. The next thing is, they'll be coming to your house and stopping you from doing X, Y, and Z. And we'll be right back where we used to be, where women can't do a dang thing without a man, can't get a job, can't have a bank account. We won't be able to get any sort of health care, except the privileged few, the privileged 0.01% will be able to get what they need. And the rest of us will be out here fighting amongst ourselves like they keep us doing, so that we don't go after them.
So let me
Go after them.
jump in here with this point, because I want to come back to Dr. Rogers here, because I mean, what the path ahead you're laying out is pretty bleak, right? And so, like, how are we on this path? Like, what's been getting in the way? What's been stopping us from getting what it is that we need? The things that you all talked about, right? Affordability, actual equity, social justice, people having access to mental health support. Where's the vulnerability in the current system from where you see it? Dr. Rogers, can you start for us?
Yeah, if you look at how healthcare has evolved in this country, in the early 1900s, most European industrialized countries were moving toward a national health insurance, some sort of government-funded health plan. We chose not to do that. And really what was more important was covering people because they couldn't work and to cover their lost wages rather than to pay for health care, because the cost of health care really was not that much that time. Fast forward to the 1950s, and that's when insurance started. It started before that, but it really became a big thing because this country had to do something to get people to go to work in the factories to make the things for the war. And they couldn't increase wages by law, so they provided health insurance. And this is where Blue Cross came about. This was where it was born. And then over the years, in the 70s, it then became a for-profit. And that's when it took off. This was a way to make money. And so it was never really embedded in an altruistic industry. It was never meant to take care of people. It wasn't there to help us all be healthy so that we would live longer and be healthier and be more productive. It was there to make money. And that has evolved, and it's like on steroids or performance-enhancing drugs. It's just gotten totally out of control since then. And so now you've got employer-based insurance, and who's disenfranchised from that? We all know. Poor people, minorities, and poor white people too, although they don't see it. They would rather be hungry and homeless than be in the same category as poor black people or minorities. So we have a system that is not geared to include them. So facilities have never been built in minority communities and poor black communities. They're not there. So, and it's like every other policy that this country has made. The segregation. Why is this country so great? Why do we have our wealth of black people is 10% of what white people have? So this didn't occur by accident. This is just the way it was planned, just the way it was planned. And it is still continuing. I mean, even now in Louisiana, if you look at how the interstates have been built, they're ready to build a new interstate, I think it's in Louisiana, to divide New Orleans maybe I have the wrong city, but I just read this recently, so that they're still doing that. They are still segregating us. They are still making it so that we don't have facilities and services. Our schools are underfunded. The way schools are funded, you know it disproportionately affects schools in poor communities when it's based on property tax. These things are not by accident. And so this is why I support single-payer health care, so that everyone would have access. We could put facilities where they are needed, not where they could make money. It's just like you don't put fire stations only where there's been fires. You put them everywhere. And it's just as much my benefit that the house next door to me gets the fire put out. I don't care how much money they have, put out their fire. And that's how it should be with all these other services, but it's not done like that. So with single-payer Medicare for all, we would be able to put facilities where they are needed, not where they make money, because that wouldn't be the mission. And it won't solve all the problems with access to care. It won't solve all the problems as to why poor people and minorities suffer more from treatable health diseases, but it's part of what we need to do. It's a main thing of what we need to do to address that problem. And that's why I support Medicare for all. It would be funded not through your employer, but by a small tax, and people would actually pay less, and they would get more. And that's what we need to do to change the way healthcare is delivered in this country to make it more equitable and equal.
Dr. Murray, come in here. From your perspective, where's the vulnerability? Why don't we have what we need?
Well, I think that Dr. Rogers has outlined certainly clearly why we don't have the medical care that we need. Let me go back a little bit and say, you know, as a physician, if you ask me to diagnose the problem, we focus on the wrong place and the wrong reason why people get sick. Now, you shouldn't eat fried chicken every night, you shouldn't smoke, I'm not saying you should go out and do those things, but the fundamental reason why people get sick, and especially the fundamental reason why some groups of people, like poor people, are sicker than other groups, has to do with the ocean that we swim in, okay? It has to do with the whole society. So, you know, you need to have access to a physician, especially if you have high blood pressure, but you also need to have a park in your neighborhood that's safe for you to go and relax in. You need to have jobs that are safe and treat you with respect and pay you enough money to live on. You know, you need to be able to take a vacation. So there's so many things in other countries that are standard that we don't have in this country. In most of Europe, for example, there's mandated by law 4 weeks of vacation, often more than that, depending on what kind of job you have. You know, most Americans don't even take 2 weeks vacation, whether they have the time or not. It's mandated that young children have opportunity to go to what we call day school or nursery school. You know, that doesn't exist everywhere. So the understanding that, again, in order for me to be healthy, the community that I live in has to be healthy. The country that I live in has to be healthy. And to me, you can't have that without basic social justice. So we start off with the wrong diagnosis. We act as though in order for you to be healthy, you have to be perfect in all your sort of personal habits and rich. They don't say that out loud, but that's what they mean, and rich. And if you're not one of those things, then it's like you don't deserve to live. So I think the things that Dr. Rogers is pointing out, that people are allowed to make money, lots of money, off of people being sick, is unconscious. And that doesn't happen in other places in the world. And now, let me be clear, there are other countries where people do make money, but it's a question that everyone has a basic right to those basic needs. So having a right to medical care is one thing, but having a right to health and well-being, that means parks, education, and all those other things, are just as important.
So before I go to Sam, let me just probe a little bit further, all right? Because the question that comes to mind is, how are we going to pay for this, right? How are we going to have parks in every neighborhood? How are we going to make sure everybody has access to quality health care? I mean, there were, in the last 2 years, I think 4 hospitals have closed or were threatening to close in the immediate area, right? So clearly there's some disconnect, right? Like how do we provide these things that you're saying we need and pay for them at the same time?
Well, there's only a disconnect if you don't understand how money works. So let's look at the vaccines we're talking about, which Pfizer and these companies are making billions of dollars out of. Who paid for the discovery of the vaccine? The sister over here. You know, who paid for the science behind it? That sister over there. Who paid to manufacture it? That brother. So in other words, the resources of all of us, and not only all of us, but our mamas and daddies and grandmamas and granddaddies going back, paid for all of this stuff. These people don't make a profit by, they didn't build the highways, we built the highways. So if we start off with who makes the money and the wealth, the people make it. And if we understand the system that we've used, even in this capitalist system, to pull in money for the common good, Amazon doesn't pay taxes, Walmart doesn't. If they would pay the taxes that were paid when Roosevelt was president, or when Truman, we're talking about a 90% tax rate there. You know, if we would go back before World War II, if those people paid the same taxes that they paid back then, we would have more than enough money to do all of this. But it's not going to happen if we allow them to continue to steal our money and use it for their personal good.
Come on now.
Those parks, the land, the air, the water, the wealth that exists, we built. And not only we Americans built, but all over the world. We now are dealing with climate change, which is threatening the whole planet. And unless we come to address this, if these people don't have a right to just ruin the planet, then you're right, we're going to lose. But if we just start off with basic common sense and say these things are rights, and you don't have a right to kill people so that you can have 500, yachts or whatever it is.
Come on, man.
All right, we're going to come back to that. Sam, from your perspective, what's holding us back?
Profit motive. Two things, profit motive and systemic racism. It goes back to the 1670s, when people were being brought here by the boatload against their will and being forced to build a country, build a nation in which y'all would never get to share equally in. And that's absolute bullshit. And we are hemmed in by that. And we are hemmed in by the notion that we're hemmed in by capitalism as well, because the notion that our only value is to make money for somebody else. Our only value is how many hours we can work a day without a break. How many months you can go without taking a vacation. Ooh, they're a strong employee, they haven't had a vacation in 7 years. What is that? People around the rest are laughing at us because we don't have good sense most of the time. Common sense is no longer common. We are in this race. There's profit motive in every aspect, but especially in healthcare and pharmaceutical, especially. And Dr. Murray brought up the word vaccine, and I had said earlier that if I said the word vaccine, somebody needed to throw something at me, because I was going to start. But just let me give you just one statistics. As of the 3rd of August this year, 1.1% of the total people living in low-income countries have received a vaccination shot. Not 2, but just 1. And that statistic comes directly from the WHO and from WHO and the World Bank. It's money and systemic racism. The rich people, the ultra wealthy, not the people you and I get to see. We don't get to see the rich people. We get to see the people we elected to represent us in government. But we don't get to see the ultra wealthy people who are actually running those people that we put in place. They've got money that we can't see, and they're putting it in our political system, and they're buying our senators and our House of Representatives. And everybody who runs everything, they're buying them. And they have to play those rich people's game. I'm not talking about the rich people you can see just driving down the street in Chicago and see their big old, house on whatever street. I'm talking about really rich people of the 500 yacht variety. We are playing their game. They keep you and me at each other's throat, squabbling over little crumbs. And that ain't right. But we can change it, because there's, I'm gonna make up a silly number, 900 million billion of us, and there's only 56,000 of them. And that's why they fight so hard to keep us at each other's throats, because they don't want us realizing the number imbalance and going after them and taking back our money that we made them and taking back our resources. They don't want that to happen.
Ms. Ball, let me pull you in here. Round this out for us. From your perspective, what's happening?
It's mainly political, and I always encourage people, when you go to the polls, remember what your politician, your congressman have done. If they sold out, get them out of there. And so because we have too much diversity and we have a culture of people, it's not a black, it's not a white issue, but it's all of our issues. When one person is sick, it brings everybody down. I'm training to be a SANE nurse, so I want to kind of bring this into the plate, if I can. Okay, according to RAIN statistics, sexually violence affects millions of Americans. Every 68 seconds, an American is being sexually assaulted. And that encompasses women, girls, moms, boys, transgender, queer, non-conforming. But I really want to focus on one specific group. Not the Native Americans, because they are the greatest risk of sexual violence. Because I'm talking political right now. Sexual violence affects thousands of prisoners. Over 80,000 prisoners each year are sexually assaulted. And I think it's more of a political, because most of the time it's from the jailers, the inmates, but it's still affecting us because these people are in prison and our tax dollars is drawing them in. I would like to briefly tell you a story about a young man named Gene. Gene was in prison at the age of 19. He was wrongly accused of robbing someone's house. Someone said they saw him, black young man, 19 years old, fixed all the statistics, wrongly accused. So now he's in prison. Very attractive young man. He was sexually assaulted. Now mind you, this young man decided to write me a letter. And he said, I want to die, I want to kill myself. He said, every night I can't sleep in peace because someone is sexually assaulting me. And when I try to tell someone, no one is listening. Remember, our political dollars are going into this system. And so now, we get a call, and this young man was set on fire with gasoline. Now, how did they get the gasoline in the system anyway? He was burned to death. So people talked to him, so when it was my turn to talk to him, he expired. He succumbed to death. So I didn't get a chance to talk to him. Now, his dad converted to alcoholism, thinking there's no hope. So he drank himself so much and became a chain smoker. So eventually he ended up dying because he didn't know that there was affordable health care out there for him. So he ended up going to the emergency room because he could not afford the health care. So he ended up dying. The mom, the poor mother, she had CAD, coronary arterial disease. Also, because she had other children, she worried so much her blood pressure just shot through the roof. She would go to the county hospital to get care because she could not afford. When you make a certain amount of money, you cannot afford health care. They say you make too much, so therefore we can't give you a penny. So now every penny you go, you can't really rise up out of the system. And so I think we should blame our political system on these issues. Eventually, she ended up dying. And what is so sad, one thing affected another. Sexual assault affected the mom, the dad. You know, it just was a big issue. And how sad, because I believe if we vote the right people in, who's going to stand up for our rights, fight for our health care, I think we'll be all right in the long run. Yeah. And that's what we need to do, because everybody can't afford it. And by the way, that young man was my brother. That's all.
So, Dr. Murray, I'm looking at your face, and I'm trying to read it from afar. We are hearing a lot of the problems. We're hearing the impact of the problems on everyday people. I need some solutions, right? What we've been doing has only got us what we got.
Yeah.
I need more. What needs to get done that isn't being done?
Well, I think we have to make a distinction between treatment and cure. So Medicare for all is a treatment. We need that tomorrow. We could have had it yesterday. So we shouldn't be psyched out by what's possible and what's not possible. Providing sexual assault counseling, that's a treatment. We can do that now. Having decent education, those are things we can do now. I'm not saying it's going to be easy, but we can do those things now. Having better housing policy. So a lot of the things we work on every day are treatments. Okay. And we need to fight. Look at what's going on in Congress right now. You got two bills, I can't even hardly keep track of them. There's an effort to get them to compromise backward. The two bills are not a cure, let me say that. Okay, you know, you got the infrastructure bill for bridges, and you got the so-called infrastructure bill for, neither one of those are cures, they're treatments. Almost first aid, they're not even real long-term treatments. So we have to get together and fight for those treatments, and we have to be able to bond together over these different quote-unquote issues. In other words, you cannot have kids doing well in school when 20,000 plus CPS students are homeless. So that means that the homeless issue and the school issue are connected. And you can't address either one of those problems when most of those families can't get medical care. And even if you have insurance, doesn't mean you have good insurance. Okay? So I have Medicare now. Medicare doesn't cover eyeglasses, for example. But look at all us old people with eyeglasses. You know? Okay? You know? So I think what we need to do, Yolanda, is understand that we're fighting for Band-Aids and treatments, and we need to fight differently. We already fight hard. We need to fight differently by pulling those things together and by saying you cannot half-step on rebuilding the country. I don't know what they say when they say rebuilding. You know, on Biden's plan is ought to be a down payment. It's not a cure. And then we need to be clear and fight for a cure. That's right. In addition to the treatment. You know, you don't wait. You know, so you can say this is just for now. This is a Band-Aid. Then we're gonna have to go in and do surgery and address who's stealing money from folks. Okay, address how many people are getting paid. How could you work 40 hours a week in this country and be poor? And what's our definition of poor? To me, like I said, I should be able, I worked my whole life, I don't care, I mean, I happen to be a physician, so I got paid more than most people, but I don't care what you do. When you're 73, you worked and you retired, you should have enough money so your bills are paid, no problem. You have a decent place to live, you have good health care, you're able to go on a vacation a couple times a year, you're able to visit your grandkids, you're able to buy your grandkids a birthday present and a Christmas present. That's just basic to me. That's just basic. So I think what we have to do is say, we need these first aid measures. We need reasonable treatments. And it's going to cost more money than we're spending now. And we need to work on cures. And if we're clear about the distinctions there, then we have some hope of making progress.
So let me pause this right now, because I'm looking at the time. Obviously, we could go for days with this conversation. But I want to bring some of the people who came to this in, because they have questions as well. So we'll get back to solutions, but there's a question here in the second row.
So Rob Wilson, Virginia Burns Hope Center. I had 2 questions. Okay.
Okay.
So one, I wanted to ask you about what you thought the cure was. Do you think it's solely economic? What do you think the cure is? And then I know with I can't see where.
Roger.
You talked about equity. I mean, we had a campaign where one of our hospitals was being closed, my neighborhood, Mercy Hospital, and we fought to keep it open. And it's still open. So we believe, and part of what we believe is to solve equity, it has to come from those who will be the victims of inequity. And so we're pushing for board positions on hospitals in our neighborhood so we can decide what happens with the services in our neighborhood, so we can have some decision-making power. And I guess what do you see that anywhere else, and do you think that may be a helpful cure in solving equity? So it's 2 different things.
All right, so the first question is coming back to the cure. So what is the cure? And then the second question is examples of community residents being on hospital boards in other parts of the country?
Yeah, and that's an example of how to bring back equity.
Okay.
Because we got to have power. And I think that's what I'm hearing. There's other folks who are making decisions for us, and we are suffering from that.
Yeah.
So how do we get that power back? How do we take our power so we can define our communities, hospitals, schools, housing, how we want to best help?
So the people who've been subjected to inequity, determining what equity looks like. Got it, okay. Who wants to take that first part?
Well, I agree with you. We do need power. And power, I've never known a historical situation where power was given.
That's right.
You got to take power. You got to be able to hold it.
Who said that?
But let me answer your question about cure in this way. Right now, I think we have an existential threat of climate change. And I think that capitalism, I never liked capitalism anyway, but I think capitalism fundamentally has to change, be wiped out, I would prefer, if we're going to address climate change. That's where a small group of people appropriate all the wealth and resources for their own good. But we're in a situation now where we've appropriated collectively so much stuff from the planet that we have what we see. And so, to me, we should, in terms of a shorter range cure, coming back to these hospitals, if we make a decision collectively, these are basic human rights. And I think in large measure the world has come to a consensus about that, about what basic human rights are. And we need to protect that collectively. So if you want to send your child to a private school that has marble stairs and diamonds in the doorknobs or something, who cares? But every child should be in a school that's safe, that's comfortable, that they learn stuff. Okay? That's right. Same thing with healthcare. Yes, we need to control a health system. In some parts of the world, like the United Kingdom, for example, the national health system is controlled by the public. That doesn't mean that it doesn't have problems, but it's controlled by the public, and the public controls what goes on with it. They still have some problems because of the politics. But for us, I think what that means is that education, housing, healthcare, transportation, these are all things that people need to survive, and we should be able to control that collectively. That means a lot of arguing and fussing and fighting because you got different people with different ideas. But we have to start there. We have to start with the tools we have. So right now, the tools we have are extremely crude, like the vote. But that's not enough. We should know that by now. We are in danger of losing it, but it's not enough. And then when you have the vote, then we have to, I would love to see a national health system in this country where the basics of our health system was controlled by the public. So that's where I would start for a cure, to make sure that people are able to secure democracy, by which it means the people have power, and then set in place those institutions to make sure that health and well-being is a guarantee for every human.
I'll just add on to, and I just want to mention too, Dr. Murray was my mentor in medical school. She's a couple years ahead of me, but she has been so influential on me, and I know she's influential on you today too. But one of the things that people talk about is how are we going to pay for this? Right now, this country spends more money than every other industrialized country in the world. More money. Yet, our mortality rate is the worst. Our maternal mortality rate is abysmal, especially with black women. Black women's mortality rate is closer to a third world country than compared to an industrialized. The infant mortality rate is the lowest. So we're already spending billions and billions, but it's not on health. It's not going to health. And even when we look at how this country tries to help, if you look at the hospitals that got money through the CARES Act, during COVID, it was based on how much they made the year before, so that hospitals in poor communities whose patients were mostly Medicare and Medicaid that brought in less money because those were the patients they took, got less money during the pandemic. And the wealthier hospitals made billions during the pandemic. So the whole system is not made to take care of poor people. So the system, the structure of the system, structural racism created this system, and it's continuing, and that's what makes it more and more inequitable. That's why hospitals like Mercy are closing. Not because they're not run well, not because they're inefficient, not because the doctors were bad. It's because of the funding. And as long as we have a system that the goal is to make money, not to treat health, not to make people healthier or the community healthier, these inequities will just continue to worsen. And it reminds me of something I learned in medical school, because these health insurance companies and the system is like a parasite. It's just feeding off of us. And one thing I learned in medical school is that a good parasite never kills its host. And they're killing us. Because pretty soon, you're going to have to be part of the 1% to be able to take care of your health care problems. And that's not sustainable, because then nobody can do anything in the country.
So I want to pull in the second part of your question, or your second question rather. We got community-based organization, we got labor organization. The question around the people who've experienced the inequity, determining what equity looks like and being able to fight for it. What does that look like? Ms. Ball, you want to go first?
Well, when I just look at just the general population, I believe if we start at a younger age, because many of us are probably past 45 and older, so if we can get those that are younger to buy into this political system, buy into what we're projecting, I think it will make an impact. Because right now we need some noise made. And if it's not made, it's not going to go anywhere. So we need to bring in everyone. We need to start them off from babies. Listen, this is how it's going to be. If you don't fight for your rights, this is what's going to happen eventually. It's important that you stay in school, that you get your education and move forward. Because if you don't, then those older or higher, or who think they think more than you, will take over. So it's important that we grasp them in while they're young. And that is how we're going to be able to move forward in economics, and I keep saying political, because mostly everything is political, politically based. And this is how we're going to move forward. We got to teach them while they're young. train up a child in the way he should go, if you train them when they're young, when they get old, then you can't pull the covers over my eyes. You can't tell me we don't have enough money for health care. You can't tell me that we can't get a cure. The cure starts early. If you train me how to take care of my body now, when I get older, I don't have to worry about all the high blood pressure or eating wrong things, the diabetes. When it gets so bad that you didn't get the care that you needed, it gets so bad because you wait years. Oh, I haven't seen a doctor in 15 years. What? You train that child young. You don't wait 15 years. During this pandemic, we seen, after everything kind of calmed down, now we have an influx of people coming into the emergency room, want health care, want this and that done. It's not a cure all in one day. So now they need Dr. Rogers, they need Dr. Murray, they need Sam, they need all of this, they need all of us. Because after they leave me in the emergency room, then they're gonna have to see you. They're gonna have to follow up. But then when you have to follow up with the doctor, oh, you can't see, here, what is it, September, 9th, 8th, 9th? Then you can't see a doctor until January the 1st.
I'm telling you.
So it's all messed up. It's all messed up. So that's why I said train them while they're young. Let them know what they're getting into. Let them know what the fight is ahead so they can go on and push forward and fight.
Thank you. Sam, you want to get some thoughts in on this quickly?
Something that we can do, how we get to equity. We need to support grassroots organizations who are recruiting, who are running and electing progressive people into our government. We need to get BIPOC people in our government. We need to get women in our government. We need to get low-income people in our government. Because we're the ones who are impacted by this every single day. We know how to run a household. I live on a fixed income. I'm on Social Security disability. I live on $300 a month because of my rent. My rent load is 75% of my income. I know how to pinch a penny until it squeals. We're the people who know the solution. We need to get people that look like us and think like us in positions in the government. We need to be electing people. We need to be helping those people get elected. All those people in New York that helped AOC get elected. All those people in Minnesota that helped folks get elected. We need to be doing that. When Dr. Rogers was talking about where the insurance company started and how things moved from not so expensive health care to insurance companies and very expensive health care. Back in the 30s, the late 20s and the early 30s, in New York, they started having rent strikes and union strikes, and they supported each other, and they got out in the street by the hundreds of thousands of people in the street demanding equity, and they got it. They got rent control in New York. New York still has rent control. That's what we got to do. We got to get out in the street. We got to get loud. We got to elect progressive people who understand what kind of solutions we need in order to live. We need to get these people's foots off our neck, because can't none of us breathe.
So we're almost back at the top of the hour again. This has been an amazing conversation to me. Thank you for all of your comments. What I want to do is, number one, I hope everybody here, those of you who are watching, heard something tonight that you can take back and add to your work one way or the other. And so as we close this session, I really want, just again, succinctly, for those of us here in the room those watching from home, we need to get out in the streets. We need to make sure our young people are engaged. Dr. Rogers, what is one thing we can take with us and do tomorrow to move us forward?
Get the genie out of this bottle. You know, that's difficult because there's so many parts to this. But I think that we have to empower ourselves to make demands. Because if we don't demand change, it will never occur. And there's so many parts to this puzzle that need to be worked on. I mean, I'm working on one piece, and as Dr. Murray said, it's not the cure, it's a treatment. Just having a doctor doesn't mean you're going to be healthy if you don't have a grocery store to buy food at, you know? So there's a lot of pieces to this, but we have to feel empowered and we have to stay on it because these people are crazy out there, what they're doing. And, you know, we have to, even though it's not healthy to get mad and stay mad, I think it's one of the things that we need to do. We have to stay angry.
Dr. Murray?
I think we have to do two things. First, do something you know how to do. If you know how to dance and put it on TikTok and that helps something, do that. If you know how to make a cake, if you know how to get a picket sign, do something that you know how to do to create pressure, because everybody in this room has done that before. Now, that ain't enough, because we're still here. And so I think you have to pick something that you don't know how to do, that you got to go to someone else, or something that may make you uncomfortable. It's different things for different people. Some people going out on a demonstration is uncomfortable. Some other people coming up here with these crazy white folks and trying to talk to them is uncomfortable. You know, so pick something else that you aren't that great at doing, that you don't like doing. Make yourself uncomfortable.
That's right.
Because we should be angry. If you're not angry, you really are crazy, sister, right? If you're not angry, you're crazy. Like my friends say, I may be crazy, but I'm not stupid.
There we go.
So, you know, do something. Do more than you did yesterday, and try to do it with different people. Expand who you work with.
And we're going to have to leave it there, everybody. Again, thank all of you. Thank you at home for joining us. This was the first of a series of events we're holding this fall to commemorate Wieboldt Foundation's 100th anniversary. Go to our website, wieboldt.org, to stay up on what's happening. This isn't it. Again, this is just the beginning. Remember what you heard here tonight. Take it back home. Talk to people in your family, in your home, your neighbors. Figure out those things that you are good at to keep doing. Figure out what you don't know how to do and go figure out how to do it, because we got to create some pressure. So with that, again, thank you. Have a good night, everybody.
All right.
Thank you. I'm so sorry about your brother. I'm so sorry to hear about your brother.
Oh, it's all good now.
You know we do it right. We do it right. Always on your side. I'm here for you, for what you need, to lend a helping hand when you wake up. Just know that we're always there. And when you call, we'll answer you and always get you through. It don't matter where you go, 'cause we're always there. Through the fire, through the change, we ain't afraid. Gonna be here every day. We walk the miles, make the space, take the time, never late. We do it right. Always on your side. 'Cause we do it right. Any place, anytime, we're always there. Rain or shine. 'Cause we do it right. 'Cause when you need someone to trust, we are always there. Set your goals, live your dreams, you can always lean on me. In blue skies are gray, we are always there. And through the fire, through the change, we ain't afraid, gonna be here every day. We walk the miles, make the space, take the time, never late. We do it right. Always on your side. 'Cause we do it right. Any place, anytime, we're always there. Rain or shine. 'Cause we do it We'll make you smile, smile, smile. We'll make you smile, smile, smile. We love it when you smile, smile, smile. We'll make you smile, smile, smile. We do it right. Always on your side. Cause we do it right. Any place, anytime, we're always there. Rain or shine. We'll make you smile, smile, smile. We'll make you smile, smile, smile. Love it when you smile, smile, smile. We'll make you smile, smile, smile. We do it right.